Cheers.
Cheers.
And welcome to Wine Wednesday with Kriz Physical Therapy. I'm Dr. Tiffany Kriz. I just had to remember who I was.
You sure about that?
Yeah,
I'm
I
Dr.
don't know.
Mike Kriz.
Maybe not. Okay. On today's episode of Wine Wednesday, Dr. Mike here is going to tell us a little bit about our injury prevention program and how it will help those of you who would love to continue to play golf, but maybe you've had an elbow or wrist surgery and you're concerned about that amount of torque that you need to put through your elbow or your wrist as you are playing the game, especially with your swing. Like those long drives when you want to hit that little tiny ball 300 yards.
All right, let's say you've fractured your wrist and you've got plates and screws in your wrist. Or you had the triangular fibrocartilage complex operated on. That's just so happens to be on this side of your wrist.
All right, Mr. Big
On the
Words.
ulnar side. And you've had that repaired or cleaned up and you want to get back to the game. Well, yeah, as Tiffany mentioned, the game of golf requires a lot of primarily ulnar and radial deviation, but also some supination and pronation. And so the wrist has to be able to move freely. But just like with any other area of the body, we don't just look at your wrist.
Or your elbow.
Or your elbow. Yeah, we have to make sure you have mobility throughout the entire upper quadrant. And in this case, the upper quadrant is your neck, your shoulders, your shoulder girdle, your rib cage, your thoracic spine, your elbow, and your wrist. There's a lot to look at. And a lot that can lead to stress on the wrist when you play the game of golf. Let's just say you lack the ability to bring your arm across, if you're a right-handed golfer, across your body with your follow through. Well, to get the club in position, you're going to do a little excess wrist hinging, okay? And that's going to create some irritation on a surgical site, whether it was from the ligament or from the cartilage or from a fixed bone. So we have to make sure that we get adequate mobility throughout that upper quadrant. Make sure you have to strengthen the endurance in the muscles, not just in the arm, but in the shoulder girdle, which is where your shoulder blade meets your rib cage, and all throughout so that you are stable through your upper extremity and through your golf swing and place less stress on the wrist and elbow and reduce the chance of injury.
All right. Thanks, Dr. Mike.
You're welcome.
Cheers, and thank you for watching this episode of Wine Wednesday. See you again next time.